Aortic regurg, abnormality of backward flow. When is your aortic valve supposed to close? Well, let me ask you: are you having problems with closing or opening? Aortic stenosis, close your eyes, was difficulty with aortic valve opening, right? So that was a systolic type of murmur. Whereas with aortic regurg, you have a problem with the aortic valve closing. Which way does it close? Here's my aorta, here's my left ventricle. It's supposed to close this way, right? But it's not. It doesn't want to close, so therefore there's going to be regurg. When is it supposed to close? During diastole. So what kind of murmur is aortic regurg? A diastolic murmur. Your next question is, well, is it early or mid? I'll show you a picture where you will clearly see why it's an early diastolic murmur. Results from valve leaflet issues, aortic root, such as, well, what if it was congestive heart failure or Marfan? Marfan. What happens in Marfan? It's a fibrillin type of issue. You're referring to chromosome 15, FFF. The elastic tissue is not being formed properly, and so therefore there might be widening of the aortic root. Welcome to aortic regurg. Congestive heart failure, widening of the aortic root. Ehlers-Danlos, widening of the aortic root. Could it be some type of infection? Well, what if you had a patient who was in the armed forces, was away from home for a long period of time, and this patient had urges and didn't exactly use proper judgment and comes back with issues with aortic regurg? Well, you've heard of syphilitic aortitis, haven't you? Syphilitic aortitis. What happened? There was something called endarteritis obliterans. You've talked about all this in microbiology. Just put it together here, and please understand the number of differentials that you have with aortic regurg. Causes. Talked to you about this with aortic stenosis. Dr. Raj, why is rheumatic heart disease here with aortic regurg? Do you remember me telling you, first and foremost, developing countries is what you're looking at with rheumatic heart disease, number one. Number two, we talked about the organism being something like Streptococcus pyogenes, or group A streptococci. Also referred to something like pharyngitis, in which the patient, the child, perhaps wasn't properly, inadequately treated, resulting in 2 to 4 weeks later issues with the heart. Right? We talked about all that. Correct. Next, early on, you're going to cause damage to the valves. Now, you tell me what valves predominantly are going to be affected in rheumatic heart disease. Left side, left side, left side. 95% of the time. So you pay attention to that. Is that clear? Now, on the left side, early on, what kind of damage is it? It's regurg. It gets floppy, vegetations. At some point, you begin the repair process. What's repair mean to you? Let's talk about fibrosis. Some may result in stenosis, and hence, in aortic stenosis, we also had rheumatic heart disease, but it's the chronic type, right? The chronic type. Developing countries. In developed countries, what are you looking at? Now, interesting enough, let me slow down here. Pay attention. Look at me. Pay attention. Okay. Pay attention. Do not look at the words right now. Bicuspid aortic valve. If it's a bicuspid aortic valve, first off, you know it's a young patient. The fact that you even have bicuspid is a congenital issue. The last time we talked about this was in a previous discussion of aortic stenosis. And we said that by having bicuspid, that you might have damaged tissue, resulting in dystrophic calcification. And what does that result in? Dr. Wright, this is a typo? No. Listen to what I'm saying. That was aortic stenosis. Absolutely correct. So, in developed countries, in which a patient who's young may result with aortic regurg, at some point, aortic stenosis bicuspid may also result in regurg. Is that clear? And do not miss this question. That's where students tend to get confused, because they are so black and white. Now, certain things you absolutely have to keep separate, but at the same time, understand the continuum. And you don't want to be so black and white that you miss a question because, it has to be this. No, it doesn't have to be anything. The process is important. So even with bicuspid congenital aortic valve, may have aortic stenosis. What kind of murmur was that? A crescendo, decrescendo, a systolic murmur, or it could be a diastolic murmur. Where would you hear this? Early diastolic murmur. Where, please? Left peristernal, moving towards the apex, maybe perhaps your third intercostal space. I hope that's clear. You spend a little bit of time with this paragraph. Let's move on. What else may happen? It may cause damage due to infectious endocarditis, Marfan syndrome, trauma, maybe perhaps even aortic dissection. With aortic dissection, imagine what may happen. You might have stabbing back pain, right? And when you have stabbing back pain, well, if you have enough dissection, is it possible that you might then have retrograde flow through the aortic root and cause widening and expansion of the aortic root? Of course. Of course. And so aortic regurg might be present, and maybe even perhaps the blood is rushing in a very rapid manner into the pericardial cavity. What's that called? Rushing rapidly. Tamponade. Clear? A lot of things we're putting together because it's not just bullet points in which you're memorizing. You're bringing in information in which you're setting up the foundation and building. Let's continue. Aortic regurg. As the valve continues to come in, then you'll have more blood coming in. What is that ventricle going to do? It will then cause increased size, hypertrophy, resulting in what's known as eccentric hypertrophy.